I am Dr. Guhan, medical oncologist and director of Sri Ramakrishna Institute of Oncology and Research, Coimbatore. Today the number of cancer patients are rising. All of us should know about what cancer is, why cancer happens. The cancer is a disease not coming from outside, it is from within our body. All our cells go through a cell cycle. The cell cycle regulation is maintained by genes called tumor suppressor gene. The tumor suppressor gene always helps us to prevent cancer in our body if at all any damage occurs a cell due to inherently or due to external factors. But when tumor suppressor gene is mutated, mutation means that is lost, called harmful mutation. The cellular proliferation control is lost and cell cycle regulation is lost, and a lot of immature cells tend to proliferate and collect and form a big lump of useless cells. The big lump of useless cells called as cancer. The entire energy of the body, blood supply, everything has been targeted to this, and ultimately the patient suffers and he loses weight and loss of appetite. When the size of the cancer cell reaches a critical size, that is more than 1 centimeter or 2 centimeter, depending upon the biology of the cancer cells, the cancer cell tend to spread to the adjacent lymph nodes. Once they reach the lymph nodes, from there they tend to spread to the via blood to the lungs, liver, bone and other distant organs. That is called metastasis. So why should we know about cancer is, when you detect cancer at the early stage, it can be cured. The most successful cancer treatment mainly depends upon the early detection. So how to detect cancer early? The most important is we should know about screening. Screening is to detect cancers early at an asymptomatic individual. To screen what are all the cancers are amenable in India, mainly women cancers, mainly women above the age of 40 years. If they undergo a mammogram every year, you can easily detect a lump, and the lump detected through mammogram may need only surgery. It may not need radiation or chemotherapy. And pap smear is a simple test which performed as an outpatient basis, which can carry out any woman above the age of 20 years. If it is married, if they are married and it has been carried out, and if it found to be positive, you can just go for a colposcopy or additional test to rule out invasive cancer, and if the cancers are detected early, simple hysterectomy is sufficient. Why a woman gets a breast cancer? Mainly breast cancer happens because early puberty, late menarche, a woman getting married above the age of 30 years and getting a first childbirth after 30 years, oral contraceptive pills, excess body fat, excess alcohol intake and a family history to an extent. So this all contributes to a breast cancer family, and if a family history is there, they should start going for a screening at the earlier stage. And if at all for cervical cancer, poor vaginal hygiene, human papilloma virus type 16 and 18 and multiple sexual partners are one of the important reasons, and rural India the cervical cancer numbers are rising. So the health education and vaginal hygiene is more important. So now other cancer, if a man who can detect early, is prostate cancer. Any man above the age of 50 years, if he undergoes a PSA, it's a simple blood test, prostate specific antigen, and a very sensitive test for prostate cancer, and a transrectal ultrasound can detect prostate cancers very early. And any man above the age of 50 years with a family history of colonic cancer should undergo a colonoscopy once in 2 years or 3 years to detect colon cancers at the earliest stage. And all these screening tests help us to detect the cancer early and to get them cured. So the success rate of the cancer treatment number increases. So when the cancer survivor increases, the confidence of public to get away from the disease also increases. So this boosts the moral of the common man, and he feels cancer is incurable is a myth, a curable cancer is a fact. And why should we know about, have an awareness? Because the number of cancer cases in India are rising. Every year 10 lakh men and women are detected with cancer, and 25 to 30 lakh people are living with cancer. And of all the 25 to 30 lakhs, every year 5 to 6 lakhs are dying with cancer. And 40 to 50% of people If they detected early, the deaths can be prevented. So how to prevent this? This is mainly if we create an awareness among the public. So what are the warning signals of cancer? See, this may not be cancer. If these symptoms are there, you may be suffering from cancer. Better to go to a physician and rule out whether you are having a cancer or not cancer. So what are the warning signals? Suppose we are having a mole or a scar in the body which suddenly increases in size and starts bleeding. If there is unexplained fever more than 10 to 15 days, if a nagging cough, if there is a hoarseness of voice which remains after 14 days, if there is a unexplained loss of weight and loss of appetite, and if there is a bleeding per rectum, all this should be early warning signals of cancer. It may not be cancer, but better to rule out cancer in such symptoms are persist. And what all the treatment modalities are available for cancer? The first ancient history is surgery. So surgeon was the first cancer physician. So radical surgeries were the hallmark of late century and this earlier part of the century. Now the surgery becomes more precision, organ oriented. Only you preserve the organ and remove the tumor. So organ preservation becomes an important goal in cancer surgery. So all these areas, limb salvage surgery, breast conserving surgery, and avoiding mastectomies, all now commonly practiced in many of the cancer centers. To do this, we should detect them early. That is why they are more important. The next treatment is radiation treatment. With the invention of radium and telecobalt, the Marie Curie, in early 1902. After that, after 20 years later, telecobalt machines were, deep X-ray therapy and telecobalt machines were available. From the telecobalt, the linear accelerators came in 1970s and 80s. So linear accelerator, they were able to give electrons, photons, along with, so the more precision radiotherapy started after 1990s. Then three-dimensional radiation, that is only, you just give radiation to the tumor with a clearance of 2 centimeters were practiced. Then IMRT, intensity modulated radiation therapy. Each beam will have different energies to a target. So you can pencil like multiple beams are passed towards the tumor. So each beam will have a desired dose distribution. And this is a very complicated treatment planning planned with meticulously by radiation oncologist and medical physicists to achieve a excellent therapeutic dose with a minimal tissue complications. Then comes image guided radiotherapy. Image guided radiotherapy is where you take a planning CT every day. Every day when the tumor shrinks 0.1 or 2 centimeters, according to the target volume, you alter your radiation portals and you reduce the, you give the dose according to the reduced target volume. This is called image guided radiotherapy. Now it's commonly practiced in many of the centers. Then radioisotopes, localized isotopes were injected, like using radioisotopes brachytherapy in prostate cancer. So all these are new areas in radiation therapy. The next branch is medical oncology. After the Second World War, after 1945, the atomic bomb energy survivors, they developed severe bone marrow hyperplasia. This prompted people to test this the chemical compounds associated with atomic bombs, then alkylating agents and anti-metabolites like methotrexate, busulfan, melphalan were came. They were the ancient chemotherapeutic drugs. Cyclophosphamide were tried as single agent. Then from the single agent, the multiple agents, combination chemotherapy came. Next to combination chemotherapy, now there are the era of targeted therapy. Identify a particular target. For example, for lymphomas, you got a CD20. It is an antigen expressed in the lymphoma cells in B cell, large, diffuse large B cell lymphomas. You target the CD20 with rituximab, a targeted therapy, which gives more target specific therapy, the less complication and more cure rates. And not only for lymphomas like that in breast cancer and colon cancer and head and neck cancer, targeted therapy plays a major role, and more and more targeted therapies on the pathway to come to reduce the toxicity and increase the efficacy becomes the goal of medical oncology. So next, so why we wanted to talk about all these innovations? Initially, the people should get away with that if the diagnosis of cancer doesn't mean a death sentence. There is a treatment definitely available, and it's not as complicated or as undesirable as it was. More sophisticated, with excellent quality of life can be maintained, and get rid of the disease. You can live long happily. The diagnosis of cancer doesn't mean end of life. So there is always a treatment exists to overcome the cancer, and you can lead a healthy life after that. The lot of cancer survivors living around you gives you a moral boost, and they are the standing examples for this. So don't lead a healthy life and try to avoid cancer. If at all cancer strikes you, do not worry. There is a treatment is there to get you away from the cancer.